Today we will see about the technique of intubation. So what is intubation and when we have to do it? Intubation means we have to achieve the protection of airway by inserting a tube which is called as endotracheal tube into the trachea of the patient. Okay, so it can be done in emergency or in elective situations. So in emergency where there are life-saving conditions are there, when there is loss of the protective response or reflexes of the patient, and there is chance of the aspiration, okay, or to develop the hypoxia. So there are different conditions for that. But now we will look, or mostly we are concerned about is the intubation in elective cases. Now elective cases are mostly done for the administration of general anesthesia, elective intubation, or in the setting of ICCU. Okay, so what we need for the intubation? Actually we need, so as you can see, I can ventilate, okay, but if I am not able to ventilate, what I can do is push through the oral airway or nasal airway depending on the condition. Okay, so what is important is to achieve the proper ventilation of the patient. Okay, the most important thing along with these all instruments is suction. Okay, you should have a nice working powerful suction at your side when you are doing the intubation, because it is very much essential. Okay, so you have to give the rescue breaths, okay, at least 5-6 once you are sure that the patient is paralyzed and unconscious. Okay, then you can proceed to the actual intubation. So as we have seen, there is a working laryngoscope, light, okay, the blade, proper size blade. What you have to do is you have to go enter to hold or fix the head with one of your hand, okay, and you have to hold the laryngoscope in the left hand. Enter into the mouth from the right angle of the mouth, okay, go in, okay, go in till you see the base of the tongue, okay, and what you have to do is shift the tongue on the other side, left side. I am going in, okay, till I am at the vallecula. Vallecula means it is the junction between base of tongue and the epiglottis. You can see epiglottis, this flap-like structure, rhomboid structure is epiglottis. Okay, so as you can see, when I am pressing over the base of tongue, there is movement of the epiglottis. Certain things or the instruments for the intubation. If you start with the gloves, okay, then the mask, then the ambu bag with reservoir bag, and the constant supply of oxygen through the system, which gives you supply continuously in uninterrupted supply. Then you should have the nasal airway, oral airway, proper laryngoscope, working laryngoscope, okay. The blade should be one side up, one side down, okay. So here you can see number 3 and number 4 blades, then syringe, and then the endotracheal tube. Okay, the tube number depends on the patient's age, male or female factors. We should have a tie to secure the tube in the position once we intubate. Okay, so these are adjuncts if we need, if there is any difficulty in ventilating the patient. When intubating the patient, This is bougie. So if you have difficulty in passing the tube through cord, okay, and the tube is not going in, so what you can do is push this bougie inside the cord. Okay, the J tip should be going into the trachea and then railroad the tube. So we will see it when we will doing intubation. So these are the things which we need. So we are ready for the intubation. Put on the gloves. For intubation, because we are talking about the elective intubation, we need to give some sedation. Okay, so when you are giving sedation to the patient or making the patient apneic or paralyzed, what you have to do is you have to manage the airway. Okay, so here in this mannequin we will see what to do. Okay, first of all, you have to make the patient in the sniffing air position. Okay, you can extend the head so the mouth opens and apply the mask nicely, make a proper seal, and if the patient is apneic and patient is unconscious, then you can give the rescue oxygenation. Okay, as you can see, I am able to ventilate. Okay, now if I have not given any muscle relaxant, I will advise someone to give the muscle relaxant. Okay, you can see the epiglottis here. Okay, and then the cords. Now we can see the vocal cords. Okay, but here I think that there will be difficulty in passing the tube. Okay, so what we will do is we will use the bougie. Okay, in this condition we have to use bougie. Otherwise I can try once. If it goes in, it's okay. If I, as you can see, I am trying to go through the cords. Okay, but there is some difficulty. Okay, so I am not able to advance through the cords. Okay, so this is the common problem. Okay, so what I will do, I will stop, I will come out, then पीछे आना मैं जब बाहर I have to ventilate the patient because I have to oxygenate. Okay, so these are real difficulties during the time of intubation. Okay, intubation is not always simple. So I did the rescue oxygenation. Now I am taking the bougie. Now I am again going in. Okay, now I can see the cords. I have entered into the trachea. Okay, now load the tube. To railroad the tube or the bougie. Okay, pass through the tube through the cords. Okay, pull out the bougie, please. I think I'm in. Okay, so once I'm in, what you have to do is inflate the cuff, okay, and hold the tube like, and see if you can ventilate, okay. So as you can see, both side lungs which are exposed, you can see moving when I am doing the ventilation. Otherwise, in live patient, what you have to do is to auscultate on the both side, and you should see that the air entry is proper on both side. Then as I am giving ventilation with 100% oxygen, I can disconnect it. If I have someone to tie, I will get help. You need one assistance for tying and helping you out to hold the tube, tie the tube, okay. So once tying could be different with different people, okay, or you can tape it. You can tape and secure the tube, connect the umbo bag and ventilate. So you should be sure that the marking is proper, okay. The depth of the tube should not be too much in or too much out, okay, and you should see the ventilation. After this, we can connect to the ventilator, okay. So preset ventilator is setting, okay, and you can start the ventilation, okay.